Vertigo Recovery Doctor. I'm Dr. Kevin Smith. I'm a vestibular physical therapist, and today I'm going to talk about 3 key signs that you may be experiencing vestibular migraines or that your vertigo is coming from vestibular migraines. So, vestibular migraines can be pretty difficult and challenging to diagnose. One, because the symptoms can be very vague, kind of global as well. So it can be difficult to kind of pinpoint the symptoms, and a lot of times migraines can be very individualized, so it can vary from person to person as well. And not to mention how people describe their dizziness is different. Almost a lot of different people describe their symptoms differently. And then the other reason is that the symptoms, the episodes can kind of blur into one another. So it's hard to sometimes see when one episode starts and another one ends. So it can just be kind of challenging to diagnose this, and not to mention that it can also come with other diagnoses as well, that can be hard to pull those apart from each other. But let's get into 3 key signs that you may be experiencing vestibular migraines or your vertigo is coming from vestibular migraines. And the first one being is if you're having multiple episodes of vertigo. So if you have one episode, like let's say a vestibular neuritis, typically there's this sudden onset and then your symptoms progressively improve. You don't typically have another episode of vestibular neuritis. It can happen, but it's not as common. If you continue to have episodes of vertigo, you may want to consider or think about vestibular migraines as a possible cause. So that's the number one, is if you're having multiple episodes of vertigo, they're recurrent. Now, the second one is going to be the duration, because you could be having BPPV, those little crystals coming loose, because you'll have multiple episodes of that. But that's going to be coming on with positional changes, and it's also going to be coming on typically lasting less than a minute. So the duration is the second key point to this. Your symptoms will last anywhere from 5 minutes up to 72 hours. So it could be a couple of days that you're having a vestibular migraine episode. And lasting from 5 minutes to 72 hours, that's a huge range, right? And so again, what I was talking about, it can be difficult to kind of figure this out and what you're experiencing. So the first one being multiple episodes. The second one being they're lasting from 5 minutes anywhere up to 72 hours. Now remember, BPPV is going to last typically less than a minute. So that's how you can kind of differentiate those two. And then vestibular neuritis, usually it's a sudden onset and progressively improves. So vestibular migraines, that's that kind of longer time range. And sometimes you'll have this kind of, you'll have a vestibular migraine. Maybe it lasts a couple days, but you can have this kind of hangover effect afterwards as well. And especially if it bleeds into another episode, it seems like maybe you're having this constant dizziness. So that's another thing to kind of keep in mind, is that you may almost be feeling like you're dizzy all the time. It just kind of gets worse, then gets better. That can be the case with a lot of different chronic types of vertigo, but just know that can be a pattern of vestibular migraines as well. So the third thing is going to be that you either have a history of migraines. So that's going to kind of bump it up on the list a little bit, right? If you have a history of migraines, you're already used to that. They can change throughout the lifespan. Maybe you had a classic migraine where you get this one-sided headache that's really severe. But now later in your lifespan, it's changed to being a little bit more of this dizziness, vertigo, and you still kind of have some of those migrainous symptoms with it. So just know that migraines can change, right? So a history of migraine can be one thing, or if you're having a migraine characteristic with your vestibular episodes or your vertigo episodes. So this could be that classic headache with it. So one-sided headache, moderate to severe in intensity, throbbing and or pulsating in quality. Those are kind of some of those more consistent with migraine headaches, and that could be one of the characteristics along with vestibular migraines. But I'll tell you, a lot of my patients with vestibular migraines have no headache at all. And so that's something that's a little bit different than what most people typically hear of or experience with migraines, is that headache. Vestibular migraines, you could have no headache at all, but maybe you have dizziness, maybe you have vertigo, and you have light or sound sensitivity. So that's another migraine characteristic. So we're looking, a lot of people could have sound sensitivity from something that's different, but particularly when you're having those episodes that are lasting anywhere from 5 to 72 hours, you're noticing that your light sensitivity is worse, your sound sensitivity is worse. So I'm thinking during the episode, are you having that light or sound sensitivity that has gotten worse? So those migraine characteristics, another one can be a visual aura. So seeing lights or patterns, or sometimes people describe like a tunnel vision type of experience. There could be a lot of different kind of types of auras. Maybe sometimes people feel this numbness, tingling kind of sensation as well. And it can be a little bit scary because some of those things can be associated with a stroke as well. So that's when it's important to talk with your medical professional. If you think you have an emergency or emergent problem, call 911. But especially if this is something new. But if it's something you've already been worked up for, and everything has looked normal, and you've already been diagnosed with migraines, you know that this is something that typically comes along with what you experience with your migraines. So those migraine characteristics, which can be the one-sided headache, throbbing, pulsing quality, moderate, severe in intensity, or light sound sensitivity, visual aura, or whatever other type of aura or migraine experience that you may be experiencing with those. So to recap what those three key signs are of vestibular migraines is, one, it's going to have multiple episodes, right? So it's not just going to be one and done, and then you kind of have this kind of constant rocking, swaying. You have these kind of recurrent episodes. Two, they're going to last anywhere from 5 minutes to 72 hours. So that duration, so the frequency, the duration is a little bit longer. And then three, you have a migraine characteristic with it. So that's going to be either the headache, light sound sensitivity, visual aura, or whatever other migraine characteristic that you may be experiencing with your migraines. I hope this was helpful for you. I hope it helps you kind of differentiate some of these things. The other thing to consider is that with vestibular migraines, you may have other vestibular diagnoses that may go along with it. So a lot of times you can have cervicogenic dizziness with it. You can have 3PD, persistent postural perceptual dizziness. And that can make it really difficult to kind of pull some of those things apart, because again, that'll make it feel a little bit more constant in nature, that you're always being dizzy. But pay attention to the quality of the symptoms. The quality of the symptoms may differ depending on what's causing it. But a lot of times we kind of see that all three of those diagnoses, the cervicogenic dizziness, maybe the next causing dizziness as well as triggering migraines. And then those migraines a lot of times come along with 3PD, this kind of constant rocking, swaying sensation, sensitivity to motion and visual environments, stuff like that. So pay attention to that, as well as that you can have more than one diagnosis. So if this was helpful for you and you'd like more content, feel free to hit that subscribe button to get alerted when I come out with new content. If you have any questions, or if this was helpful for you, please leave a comment in the section below, or you can reach out to me at hello@vertigorecoverydr.com. Thanks for watching, and till next time.